So I just came out of the shower, hair is still wet, I'm ready to go to bed, but before I go to bed, I should first brush my teeth. Now, in this video, I will show you how to brush like a dentist. You might think that, well, I know how to brush my teeth, but do you? Do you really know how to brush your teeth? Because when I talk to the majority of my patients, they do it wrong. They do it completely wrong. So before I will start brushing my teeth to show you how to do it, obviously I will show you what you need. Now, I'm already sorry for the audio quality, but I'm in my bathroom and I'm making this on a GoPro, so bear with me. Now, what do we need exactly? It's very simple. Of course, we need a toothbrush. Of course, we need some floss, some toothpaste, a gel that I use on this thing, which is a mouth scraper, and also I use some mouth water. Now that I showed you all the things you need, in what sequence do we need them? So let's start with the first things first. First of all, you floss. Flossing is very simple, and why do we floss? We floss to get everything that's stuck in between the teeth, to get it out, to get it loosened. So this is why you floss. Flossing doesn't mean that you take your floss and you stick it in between your teeth and then you start doing this like a madman. No, flossing is very simple. You floss, you push it in and pull it out. In, out, in, out, in, out. This you keep on doing. Of course, I didn't brush my teeth, so I will do the complete sequence. I will probably speed up a few of these things. Maybe I can do an ASMR video on this, but no, let's not do that. So, I just flossed. Now, of course, there's a little bit of stuff stuck in my mouth. Probably there's some blood, so I will spit this out. A little bit of blood. And obviously, if you don't floss regularly, you will see in the beginning that you have, well, quite some blood. This is perfectly normal. Most people don't floss, and this way their gum is a little bit inflamed. So you have what we call gingivitis. So it's the early stages of gum disease. So it's very important actually to keep on flossing. So don't be afraid of the blood. After 2 to 3 weeks of constant flossing, then you will notice that the bleeding diminishes. So we basically floss. We got all the things that are stuck in between the teeth. We got them loosened. So what do we do now? We brush, of course. We put a little bit of water on the toothbrush and a little bit of toothpaste. I always use toothpaste with fluoride. Now, if you don't agree with this, leave me a comment and I will make a whole video on why you should use toothpaste with fluoride. But basically, the brand of the toothpaste doesn't matter. Just make sure there's some fluoride in it, or there is another option, but I will cover it also in another video. But all these organic toothpaste without fluoride, well, it's with our current diet, our modern diet, it's a straight way to cavities. This is all the toothpaste you need. You don't need it quite a lot. And then, of course, you take the toothbrush. In this case, I'm using an electric toothbrush. And patients often ask me, is it better an electric toothbrush? I would say, yes, it is better. In theory, it is not, but in reality, it is. But don't use your toothbrush, your electric toothbrush, as a normal toothbrush, because many of the people who use electric toothbrush still brush like this. Just don't do it. In the advertisements, you always see the model, and she's always brushing her teeth, like slowly going like this. And this is how you should do it. So let's get started. It doesn't matter where you start, upper, lower, whatever. You also hear, now I'm gonna put it off a little bit. You also hear that my toothbrush makes these small, these small differences in sound, like zzz, zzz. This basically means on this toothbrush that 30 seconds have passed. Didn't tell you how long should you brush. Well, at least a minimum of 2 minutes. So let's continue. Also, another cool feature about this, but this has, of course, this toothbrush is basically the Rolls Royce among toothbrushes. Has many other features, all unnecessary. But one of the things that is necessary is a pressure indicator. So this one, you'll see that it's blue, and if you put too much pressure, it turns red. So it actually helps you in not putting too much pressure, because if you're brushing and you put too much pressure on your teeth, well, you're basically destroying the enamel, and this is something we don't want. Now, I just flossed, I used my toothbrush, I used some toothpaste, and basically you could be done. You just spit it out, the final thing, and that's it. Clean your mouth, because probably, yeah, this is the disadvantage of having a beard. But anyway, this could be the end. However, I'm a dentist, so I told you how to brush like a dentist. Well, I'm gonna use something extra, and this is a tongue scraper. Now, actually, this is the second take I did for this clip, so yeah, my teeth are already pretty clean, but we'll do it again. Because the beginning, basically the GoPro was in wide view and it was not good. So I use a gel, which is basically a gel to, well, have a fresher breath, and a tongue scraper. Now, a tongue scraper, what does it do? It actually simply cleans your tongue. Why do you need to clean your tongue? Well, to avoid bad breath. And one of the main reasons that people have bad breath is because of all the bacteria that are on top of the tongue. So your tongue has all these small crevices and everything where bacteria can enter, and if they're stuck there, you can get a bad breath. Of course, there are other causes, but this is a big reason. So if you clean your tongue on a regular basis, you actually have a much fresher breath. So tongue scraper, I have to watch a little bit in the mirror because it's for some reason easier to do it. But basically, it's very simple. You just put it on your tongue and you start scraping from the back to the front. A little bit like this. And once you use this for the first time, you'll be surprised about the filth. Even if you have good oral hygiene, you'll be surprised about the filth that you can get out of from your tongue. Now, another problem is many people have a gag reflex. So they'll say like, yeah, I cannot use a tongue scraper. I always have to gag when I put it in. Well, first of all, you can get used to this. So if you just keep doing it, it will come more naturally and your gag reflex will disappear. And another trick is, actually, I saw this on TikTok and I said, this cannot be true, but it actually works. So if you want to have a few seconds that you want to really stick it deep, you just pinch here in this area, pinch for 6 to 10 seconds. And then you should do like this a few times, and then you can stick it way more deep. So it actually works. Very useful for tongue scraping. Okay, final thing. Because of the gel with the tongue scraper, it gives a weird taste for me. I will clean my mouth. I will rinse it with some water. But like I said, now I will just rinse out all the fluoride. So the final thing I do is I'll take some mouthwash, not too much, half a cup is good. Voila, and I'm done. Now I'm gonna clean the beard a little bit. Well, now you saw how a dentist brushes. Well, let's summarize everything. First of all, you floss. Flossing to make sure that everything which is stuck between the teeth is loosened up. Secondly, you use your electric toothbrush with some fluoride toothpaste and start brushing for at least 2 minutes. At least 2 minutes. Thirdly, I use a tongue scraper with some gel on it. You can also use it without the gel. Basically to clean my tongue, and this is to get a fresher breath. And because I rinse afterwards with water, I will use a mouthwash with some low concentration of fluoride to have a fresh breath and to make sure that during the night there is some fluoride left. You may also wonder and ask yourself the question, do I have to do all of this for all the times that I brush? Well, of course not. Like I said, what is mandatory is the flossing and the brushing with the toothpaste. Now, even in the morning when you woke up and if you didn't eat, you can omit the flossing. You don't need it. There's normally nothing extra stuck between your teeth during the night. So in the morning, if you don't eat anything, well, you just simply can brush. All the other things are extra, but if you want the complete treatment, flossing, brushing, tongue scraping and mouthwash. So if you liked the video, please hit like, subscribe and turn on the notifications. It means a lot to me. Sorry for the quality on this one. It's, like I said, it's filmed with a GoPro. And if you have any questions or you don't agree with some things that I said, well, drop me a comment and maybe I will make a video on one of the comments.